Hello everyone and welcome to today's webinar. This is part of Avamo's 2021 Healthcare Webinar Series. We are glad to welcome Ashley MacMillian from St. Luke's today. And talking to Ashley is going to be Kunal Contractor from Avamo. If you have any questions about this webinar or questions for the speakers, you can type in the question in the GoToWebinar tool, or you can always email healthcare@avamo.com. Towards the end of the webinar, I will be handing over the questions to Kunal, who will then run the Q&A session. So without further ado, here is Kunal Contractor.
Hello, everybody. Good day and welcome to our webinar today. I am absolutely delighted to have Ashley here from the St. Luke's Health System. And today we're going to be talking about how we are going to be working on innovating the digital front door in healthcare with appointment automation using conversational AI. And Ashley has very kindly and graciously offered some of her time to talk to us today about what she is doing over at the St. Luke's Health System today. To Ashley, welcome. If you wouldn't mind a few minutes on who you are, what you do, who's St. Luke's.
Yeah, of course. So hello, everybody. Ashley MacMillian. I am an IS project manager at St. Luke's Health System. I have been with St. Luke's Health System for 13 years, just celebrated that anniversary in April, actually. And my career there has really spanned from finance to operations to informatics to now IT, leading these big strategic initiatives, which is just tapping into all those different skill sets and things I love. So just really passionate about the work I'm doing, really excited about the work we're doing with Avamo, and excited to be here to talk through some of those pieces with you all.
Great. Thank you very much. So here's a little bit on St. Luke's, and we can share that later as well. But could you just tell us a little bit more about the system?
Yeah, so reading from the screen, full transparency, but so St. Luke's Health System, we're a very, very large health system. We've got 18 hospitals spanning the Kansas City region, dozens of physician practices. We've got some small convenient care clinics, some urgent care clinics. We have some community hospitals, so quite a few different spaces that we're supporting from an IT standpoint for sure. Some of our prouder accomplishments you can see listed there. One of our bigger bragging pieces would be the first bullet there, which is the region's longest continuously operating adult heart transplant program, and one of the nation's top 25 cardiology and heart surgery programs. So really proud of that. We've got our St. Luke's Marion Block Neuroscience Institute, that's doing some really brilliant and amazing things there. Again, I will let you guys read that yourselves, but certainly check us out. Very proud of the work that we've accomplished. And then I think what really will tie in well with today's conversation that I pulled was this idea of the intersection of innovation and hope. So, really taking this leading edge technology, such as the work that we're doing with Avamo, and translating that into like the ultimate patient care, which is, the reason I think most of us are here in healthcare today is to really help the patient in whatever aspect or realm that may be that you're contributing from.
Fantastic. Thank you. I'll stop the screen share for now. So, where did your whole journey start? You're clearly using, some bots and conversational AI. When did you start thinking about virtual assistants for your health system in terms of trying to transform that patient journey?
So our Senior Vice President and Chief Digital Officer, Debbie Gash, I would imagine that her brilliant mind had started, consuming and learning more about this far before I learned about it. But I think we were introduced probably a good year ago, Kunal, maybe even a little bit longer. And I just remember all of the excitement around it. And I think, for most of us at that point, if you think back a year, we were in the midst of COVID, which we still very much are. But for us, it was, we were getting an influx in calls. We had tripled our call volume. So the question was, how do we quickly get this information to our patients? Because obviously there was a need there based upon the volume of calls and the need for that education. So I think, for us, those first two initial use cases, the COVID chatbot, which then tied into our COVID call center bot, was just based upon the need that we saw in our community. And more importantly, just making sure that our patients were informed, felt that they were getting the information that they needed. And that COVID chatbot, we've got our COVID-19 cell checker, which was huge. Because I think many of us found ourselves probably in a position where we were wondering, oh my gosh, have I been exposed? Do I have COVID, right? So just for them to be able to hop on and quickly manage something like that themselves and get the response they needed, which in turn would direct them either, towards their healthcare provider or quarantining or whatever that looks like. But those were some of the initial things that we did. And I think really it was obviously just to meet that need and demand. From there, and I kind of liken it to the hot Christmas toy, if you will, that everybody wants. Everybody in the system quickly learned about Avamo and the work that we were doing with you guys. And everybody wanted to talk about whatever, they were seeing and how that automation could potentially support the work that they were doing and help alleviate some of that monotony, if you will.
Yeah, no, fantastic. That's really useful. And I do recall those days, and I remember, starting off with the COVID stuff, and then suddenly like, hey, somebody else wants to talk to you. Are you free on Wednesday? I'm like, wait, what's this about now? Is this still about COVID? You're like, no.
Yes.
Those were definitely some fun times.
It's a fast-moving train for sure.
Yes, absolutely. So Ashley, given that this is a new way of interacting with your patients and your stakeholders as part of your digital front door strategy, how much do you think, the bot experience is going to be playing a role with the use cases you're working on? And, could you talk us through some of your current use cases?
Absolutely. So a nice, vast array of different use cases that we're both exploring and have plans to execute on. The COVID chatbot, for instance, is underway in terms of us developing both a personality and a name and just creating this virtual agent that our patients will hopefully get more familiar with and also have some fun with it, right? It's a chatbot at the end of the day, which how cool is that? So the plans there is obviously to expand on what we currently have. We've got the COVID self-checker. We've got some links in there that are pushing patients to local community resources, which, plays a little bit in our social determinants of health. But I think a big one and one that we're really excited about is our primary care scheduling use case. So the idea is that if a patient needs to schedule an appointment, they can quickly hop on St. Luke's website and you're, greeted there by the chatbot, the assistant who quickly wants to help you do whatever you need to accomplish while visiting our website. And then the patient themselves will be able to direct and manage the scheduling of their own visit. I think, most of us as consumers can agree that when you can kind of take over some of that control, it makes it a little bit easier. So that's one thing that we're working on. We've also started another use case around our help desk. So I'm sure that many can relate to, having to call the help desk whenever you need to reset your password or something's not working the way that you want it to. And, historically and as it stands today, that is a very manual task. So somebody calls obviously answered, there's a ticket placed, the ticket has to route to the appropriate team. The team is then identified, somebody has to step away from what they may be doing to reset a password. So there's a lot of excitement around that one as well. So we're automating that password reset, which, oh my goodness, I'm excited to see the numbers around that in terms of time and value. What else are we working on?
And you mentioned scheduling, but on the bot, are you going to be doing any of that through voice as well?
I'm not sure what the plan is there. So Our COVID automated bots, one is that, virtual assistant that you see and you interact with is a tool on the website. And then we've also got, what is it called? Natural language bot. Okay, sorry, Kunal. I can hop back in if that's okay though. So we have our natural language bot. So we've got two variations of it, and through our experience, and obviously through the education that you've provided, Kunal, when you have a skill with Avamo, you have a skill. So it's yours to use in whatever space you think that it's well suited for. So to answer that question with a very long response, I could see that potentially being an option as well. I think right now the plan is just to kind of allow the patients just to quickly maneuver that through their fingertips on our website, but that's certainly a possibility too.
Okay, fantastic. So, and then I've got to ask, and I think you've hopefully alluded to it a couple of times, why did you select Avamo as your vendor of choice? And, did you look at many other folks before selecting, to work with us?
So I would love to be able to respond to that question outside of my response, but really my response is it was you, Kunal. We were just so excited to work with you and your team. But no, again, going back to Debbie, who I respect and admire immensely, I'm sure that, she did her research and looked into the various different organizations and solutions and apps. And ultimately it was Avamo that we partnered with. And, I'm a little more boots on the ground executing from an IS project manager standpoint. And I've been really impressed outside of, the technology and what we're doing, which is so exciting. The teams, the support, again, from a project management standpoint, you guys are really developing that scope of work. You guys are gifting us, and it truly is a gift, a project plan. You guys break it down so that we understand the level of effort from a resource standpoint. And then, you add on those individual players that are assigned from Avamo, who've been phenomenal to work with. Sometimes I wonder if they sleep, to be totally honest, but really it's the customer service that you guys provide is unparalleled. It's one thing to be excited about new technology and implementing something that ultimately is going to transform your patient journey, which I really think this is, and that's what we're doing, and that's the goal. But then to be able to know that your teams are not only being supported, but having fun interacting with the people on the project team on the Avamo side is, that's just the icing. So a lot of fun. We've had some fun for sure.
Yeah, fantastic. Although, you could have just stopped after saying it was all about me.
I know, right? Sorry. Once it started, I just don't stop. Just keep talking.
No, that's fantastic. And, and you have actually, sent a few emails sending, kudos to our team, which I've shared with them, and they're all, they really appreciate and really enjoy working with you guys. So thank you very much for that.
Yeah, of course.
And so, as part of, what we're doing and what you're doing, and I think given some of your experience with Epic, how important is an Epic integration here, and why is that kind of a, an EHR level integration so important for a health system when it comes to conversational AI?
So when I think of Epic, I really feel like it's the hub. It's the center of everything, really. So many of departments, obviously clinically, that's how we support our providers and clinicians, but that's really where all of the information is. Again, it's the hub, to liken it to something. So to be able to quickly integrate something, it really, from an information standpoint, is going to provide a more seamless experience for our patients. Hopefully it breaks down some of the monotony. One of the use cases we didn't touch on, but I would love to kind of pull in as an example here is we're automating some of our pre-registration work, which I think, as a patient, you find yourself often filling out these forms, and sometimes it's redundant in that you're like, well, somebody called and asked me for this information, and now here I am in the clinic and you're asking for me to fill it out again. So hopefully it alleviates some of those, for lack of a better word, frustrations for our patients. So ultimately a satisfier. But just being able to have that information in one place, and then however we can utilize it and translate it back to the patients, I think that, again, and ultimately, it's just going to provide a better experience for our patient and hopefully help with some of the breakdown in terms of communication back and forth.
Yeah, absolutely fantastic. Thank you. And from your knowledge, working with our team, how important has the knowledge of how to integrate into Epic, understanding HL7 and the Fire APIs been?
Huge. So again, back to my role as an IS project manager, I can execute, right? I can get the work done. I can follow up. I can manage the relationships, but a lot of those really intricate technical pieces, it's not necessarily my language. I'm slowly adding things to my tool belt from that space for sure. But obviously, you have people who know exactly what you're talking about. And St. Luke's Health System has some brilliant minds. So, it really takes someone who knows what they're doing, especially when you're matching up with some of our guys, because they really do know what they're talking about. So just having that level of understanding, sometimes it seems like it's almost a foreign language, but both sides seem to be speaking very well, fluidly, and able to really execute on some of those more technical heavy pieces for sure.
Fantastic, thank you. And then I think finally, so I've got maybe one or two more questions for you. Then we'll go into a live demo that will show us someone actually making a phone call to schedule an appointment, so we can see how that works with some elements of that Epic integration. And then I think we'll have a little bit of time for some Q&A. But right now, given that you guys are so far ahead of the curve when it comes to conversational AI, especially since you're doing it in both text and in voice, what advice would you give to other health systems who are, have just started their journey or who are just about to start their journey?
I think it's really exciting. So you certainly want to match that enthusiasm and excitement in terms of the teams that you're pulling in. I touched a little bit on the scope of work and the project plan. You guys really have that covered. I think for us, what we're really finding is the testing efforts is a little bit more substantial than we thought. But I think that, any of us who are dealing with PHI on any level really should be testing. And making sure that everything's shored up and tight and secure there. So I think just making sure that the teams have the time to test. We rely a lot on our marketing folks as well. It wouldn't be fair if I didn't pull them in as well. So just making sure, that you're working with your marketing teams to make sure that the language that, you're training the bot on, there's a training aspect to it that, it's the latest and greatest, especially too with COVID, right? Because things were changing daily. And again, that's another great piece that's been really nice from the Obama side is that dashboard. You've got this dashboard that houses a wealth of data, but what it has done is we were able to take some of our key engineers on the marketing side and quickly train them how they could update the solution quickly. It's so intuitive, which again is fantastic, right? Simplified, intuitive is key, especially when you're dealing with technology. So I think just having the right players, making sure that you're following that project plan and estimated time and level of effort, getting the right players to the table are key to the success of the project. And then, ongoing maintenance, I think, is one area we're still really exploring is what does that look like? But just knowing that somebody's going to have to manage, take care, update, review the feedback, because there is, a wealth of data, as I mentioned, so you can see what the patients are both asking, responding, any frustration points. So, it's very hands-on. So a lot of fun, but also a lot of work.
Yeah, thank you. Another one is, as I'm looking at some of the questions that are coming in from the audience, what would you say is the most unexpected piece of new data that you've maybe learned about patients, if anything, through them having a conversation with a virtual agent?
And honestly, it might be more that I've never, focused in on these spaces, so to speak, but being able to see what your patients are asking, which we can see, and it's not tied to PHI, It's just tied to that conversation, whether it's, through the bot or the natural language bot, the telephone. Just being able to know what they're asking helps us know what information we need to provide. I think there's a lot to be said there, just knowing what our patients need, because obviously their voices are key in understanding that. And then being able to quickly react to whatever that is really special, I think.
Mhm. Fantastic. Well, Ashley, I think I'm not going to take up too much more of your time. You have a few more virtual agents to get up and running soon, so I won't distract your time away from that. But thank you so much for your time today. I will go into a quick demo, and then as that is playing, I will collate some of the questions that have been coming in. So do stay on the line, because I'm sure the audience will would love to hear some of your responses to those questions. Um, Thank you again, and let's go straight to the demo. So this is a demo of somebody calling in to one of Avamo's conversational AI virtual assistants, where they're looking to schedule an appointment, but they don't remember their medical record number, because who does? And then how the bot is able to continue to authenticate them, with an integration into Webpack, and then ultimately being able to collect their provider preferences and ultimately schedule an appointment. So have a listen to this.
Vamo's conversational IVR for healthcare has logged over 150 million unique patient conversations. Our platform is a cloud-based IVR that plugs seamlessly into your existing contact center stack. Whether it's Genesys, Cisco, NICE, or Avaya, our out-of-the-box integrations will get you up and running in weeks, not months. Now, let's take a look at a real patient call using our scheduling assistant.
Hello, I'm Penny, your virtual assistant, and I can help set up an appointment with your healthcare provider. You can say something like, "We need to see our son's pediatrician," or "I need to get an x-ray. What can I do for you today?"
I need to see someone about a knee replacement procedure.
Let me see if I can connect you with the right healthcare provider. If you would, please provide me with your patient identification number.
12690. Don't know what it is.
I'm sorry, but I wasn't able to find your information using your patient ID, 12690. But no worries, just provide me with your full name, date of birth, and the last 4 digits of your social security number. Also, please let me know if you have any preferences in your healthcare provider.
My name is Tony Allen Reynolds. I was born on November 15th, 1980. The last 4 of my social is 6958. Now, I want a male doctor that does a lot of knee replacements and is near RDU Airport.
Great, thanks. Based on what you've told me, I recommend that you see Dr. Michael Bolognesi, who has a 4.92 out of 5 patients provider rating, has extensive experience in knee replacement, and is near RDU Airport. Is this okay?
Yes, it is.
Okay. The earliest available appointment is 11 a.m. next Wednesday. Will that work?
Yes, it will.
Okay. You're all set for 11 a.m. next Wednesday. I've sent you a confirmation text, and I'll also text you a reminder the day before your appointment.
Thank you.
My pleasure. Please call back if you have any questions or concerns. Thanks.
Avamo's conversational IVR is a battle-tested AI-based option that will improve patient self-service, reduce costs, and increase customer satisfaction.
Great, and there's the demo. So as that was going on, Ashley, I was able to collect a couple more questions that I think we have a little bit of time for. So I think some of the folks wanted to learn a little bit more in terms of what had gone into from your team to operationalize the chatbot, and I know you kind of touched on this a little bit earlier, but I think what the question is like how much time does it really take to are you working on this full time? Is it like something that takes like an hour a week? How much time of yours really goes in from your team to make this a success?
So I think it really depends, which I know is a vague response, but you know, like with our COVID chatbot and our natural language bot, there was a need for our community to quickly get that information. So I want to say with the chatbot, it was what, 4 to 6 weeks. Again, I think that we could have done it more quickly, but testing and making sure that the responses were accurate was key. We had weekly syncs with the Avamo team. And I really think that, from a level of effort standpoint, I know I was probably a little more involved just as a project manager and leading the implementation itself. But our individuals were still very much able to focus on some of the other project work that they were doing. But I would say 8 hours a week is a really fair kind of guesstimate. In terms of how much time the teams would need to dedicate. I think, your more complex use cases, especially when you start talking about Epic integration, that's going to be more involved as it should be, especially once you start, pulling in your security teams. They're certainly going to want to also partake just for the PHI piece in and of itself. I think one of the nice things, though, to people who are considering Avamo as a solution is hopefully that we have worked through any kinks, not that there have been any necessarily, but like I would think that at this point everybody's got it down pretty well, so that if it's something that you need to quickly lift to support whatever need you're seeing in your health system space, you can probably do it in a few months, if you will, again just depending upon the use case and size of the organization and what you're wanting to do.
Fantastic, thank you. The next one here is you talked about a few of your current use cases. Is that it, or do you have any kind of plans to do anything else?
Oh my goodness. So I was actually talking with our CIO. I had asked her for some information regarding St. Luke's just to make sure that I was appropriately representing our fantastic health system. But it clearly jogged something in her memory, because she said, oh my gosh, I need to talk with you about this and this. And we haven't had the conversation yet, so I can't tell you specifically what those use cases are, but Avamo is becoming a very well-known term in the organization. So I think, we've got several under our belt now. We've got some in the wings waiting. Again, our PCP scheduling use case is going to be a really big one for us. Hopefully we can get started on that. But I also see a lot of expansion and growth, and automation is the key. So I think we're probably going to be working with you for a while. So all that to say, you're not rid of us yet. St. Luke's is probably going to hang with you for a little bit longer, for sure.
That is not a problem, because I know how much I love barbecue, and I just cannot wait to travel out there and actually finally meet you in person. And of course, and I think maybe extrapolating off that, one of the questions is, you kind of discussed why you kind of selected the company, but did you start this for for an ROI purpose, or just to drive patient experience? What's the kind of core driver?
I would say patient experience. I think at the root of everything we do, it's about the patient journey and transforming that for them in whatever way we can. I think, in terms of society and where we're at, like we have come to have somewhat of an expectation in terms of being able to quickly get whatever need we're needing to satisfy, whether it be, information or healthcare. So I really think that, again, at the root of it all, it's just about making sure we're serving our patients and they're getting the needs that they need met in a timely manner, and the more quickly, the better.
Mm-hmm. Fantastic. Well, I think, I don't want to take up any more of your time. Thank you so much again for your time, Ashley. I know there's a couple of questions that have come in from me, which I think I generally get pretty much nearly every time we do a session like this, which is always, how much does it cost? How long is it going to take? What else do you guys do? So with that in mind, here is a small selection of some of the use cases that we work on all of these are going to be integrated into your Epic environment or EHR. So whether it's Asana or Allscripts, or anything else. So whether it's from a non-authenticated perspective to a deeply personalized and authenticated environment. And if you'd like to learn anything more, please feel free to reach out to us, email healthcare@avamo.com, or check it out on our website. But otherwise, thank you all very much for your time today, especially you, Ashley. Tremendously grateful for your time again, and hope you all enjoy the rest of your day and stay safe. Thank you. Bye-bye.